Welcome to Robert Wood Johnson University Hospital's Health Talk. I'm Dr. Douglas Oshinsky of Robert Wood Johnson Physician Enterprises, Warren Internal Medicine. Each day, there are patients at Robert Wood Johnson University Hospital in need of blood transfusions due to an accident, surgery, blood disorders, or an illness such as cancer. By donating blood, you can help save 3 patient lives. On today's show, we will learn more about the need for blood, the blood donation process, and how you can help. We are pleased to be joined by our guest, Sally Wells of Robert Wood Johnson University Hospital's Blood Services at the New Brunswick campus, and Christia Keyte of Robert Wood Johnson University Hospital's Blood Services at the Somerset campus. Blood, such an important part of life. You guys are so important in helping to get the blood to those people. Tell us a little bit about, again, why we need, what blood is, why we need to donate blood, and what happens for blood donations at both Robert Wood Johnson, New Brunswick, and at Somerset.
Well, let's start with the amount of blood that Robert Wood Johnson University Hospital patients used in the calendar year 2015. Some 35,000 units of blood products were transfused between our New Brunswick and our Somerset facility. Our blood services was able to supply approximately 25% of those products, but on a daily basis, we're reaching higher and higher, further and further into the community, trying to do as much education and motivation as possible to get people to donate.
Yep. And blood it's a product that we can't get it any other way. And we are very fortunate at Robert Wood that we have a blood donor program. A lot of hospitals do not have that, and they depend upon outside sources. So we are very fortunate that we have our own blood donor programs, and there is no other way to get those products other than volunteer donors. There is no synthetic blood that we can purchase, so it's very important that people realize the need for donating blood.
I've learned over the years, and particularly the past 15 that I've been at Robert Wood, that the connection between the patient family and the hospital is enhanced through the blood services experience. When people are sick, when people are feeling less than optimal, their family in particular is always looking for a way to feel better, to help themselves, to help their loved ones. There's nothing more encouraging you can do than to ask your friends and family members, neighbors, to get involved with your loved one's health care and donate blood. And we make it very easy at Robert Wood. We have 2 very convenient, well-appointed, fixed-site mobile rooms in our facility at New Brunswick and Somerset.
So tell us a little bit about, someone who wants to donate blood at either Robert Wood Johnson University in New Brunswick or Somerset. What is the process? How is it done from start to finish?
Okay. Well, there are different types of donations. And the most common type of donation that most people are familiar with, that you would typically see at a blood drive and that we do at both sites, is called a whole blood donation. And an allogeneic donation is what is referred to for a volunteer donor. Okay, so the typical process takes about 30 minutes. We take walk-in donors. It's sometimes best to have an appointment. That way you won't have to wait as long. But the process has basically 3 different steps to it. And so when a donor comes in, everything we do from start to finish, we're looking at making sure that the donor is protected and that it is safe for the donor. We want it to be safe for the person receiving the blood, and we want the product to be a quality product. So first, when they come in, we go through a series of questions. We give them reading material initially. They'll read through that so that they get familiar with what to expect. And we go through a lot of questions, but they're all important. And these questions come from regulatory agencies that oversee a lot of what we do so that it's standardized across the nation. So we go through those questions, make sure that every question is answered in a way that we know the process will be safe. And then we go through what we call a physical exam. We want to make sure that that person, that it's safe for them. So we check their blood pressure, their temperature, we check their iron level, and we go through that process. And once we know that it is safe for them and that it will lead to a quality product, then we go through the actual phlebotomy. And the needle is only in a person's arm for maybe 5 to 10 minutes. We take 1 pint of blood, which is really only about 10% of your total blood volume. Some people may feel that it's a lot of blood that they give at a donation, but when you look at your total blood volume, it's really, it's safe for donors to give. So that's pretty much it. And we always give cookies and juice at the end. So sometimes, you know, people come in just because they like good cookies. And the whole process is about half an hour.
I think there's 2 things that I'd like to mention as well, and that is that we're fortunate that in both locations and whenever we have a blood drive, we have bilingual staff. So if your primary language is not English, we do have the ability to support your volunteer blood donation needs as well. The other thing I wanted to mention was in preparation for any blood donation, regardless of if it's a volunteer blood donation, what Christia referred to as an allogeneic donation, or an autologous donation, which is when you, the doctor, believe that there's going to be a need and a benefit for your patient to receive a blood transfusion, and so you request that that patient be prepared by donating his or her own blood, and we do that in both locations as well. But in preparation for a blood donation, it's very important that you're hydrated. It's very important that 24 hours before we're going to take this 10% of your total blood volume from you, that you prepare yourselves by drinking extra fluid, by getting a good night's sleep, and by eating at your normal time before you come for your donation.
So again, unlike coming for a blood test, we want the person to eat beforehand.
Correct.
And we want them to drink excessive amount of fluid if at all possible.
Correct. Absolutely.
We don't want them coming in dehydrated.
Right.
We want them to be coming in full of fluids.
That's right. And when you are full of fluids, as you know, one of the benefits is that your veins are, in fact, full of fluid. They're full of fluid anyway, but they're even more robust and plumper when you are fully hydrated. And so that helps with the phlebotomy itself.
Okay, and then you were talking about telling the people the different types of blood transfusions that there are also.
There are autologous blood transfusions, which are, again, transfusions or that are prescriptions, if you will, by the physician because he or she, the physician, feels that there is a need for that individual to donate their own blood, a need and a benefit.
So that's such as when someone's going for a hip surgery, the possibilities that they may lose blood, so that's when the doctor will order that in order to have the person's own blood available.
Absolutely, absolutely. The other is what we would call a directed donation. Now, a directed donation, in the true sense, is one that, again, it's ordered by a physician, but it is a person giving for another person. When it's truly directed, there is normally a physiological reason or a clinical reason that the physician wants that person to donate blood. We see a lot of directed donations in platelet apheresis because of the antigens that are associated with the platelets. And once those antigens are known, and those antigens are what give the patient a boost in their white cell count, we sometimes ask those people to come back and support them on a one-to-one basis. That's truly a directed donation. However, there are directed donations where people are giving on behalf of other individuals. There's no monetary benefit. It's more of a social benefit. And in that case, if that person doesn't use the blood, it goes into the volunteer blood supply and it can be used by anybody that needs it.
So again, those two types of blood transfusion, if they're not used by the patient, go into the whole blood supply itself.
Correct.
And again, the whole blood supply for other people, as if I donated for anyone else in the hospital.
Correct.
Now, the blood transfusions the blood donations, you said that there are different types of blood donations.
Right. So as Sally was saying, the allogeneic blood is a unit that is given which can be used by anyone, okay? And then the autologous and the designated units, which she spoke to. The autologous is when you donate for yourself. When someone donates an autologous unit for their own surgery, the criteria is a little bit different because that blood actually is only going to be used for them. They already have some type of condition where they might not be able to donate for another person. So that blood would get used specifically for them and no one else. If they don't use it, it doesn't get used. But a directed or designated unit, they go through the same criteria as anyone else, as an allogeneic. And so those units are available for the general population of patients if it's not used by the patient. And both of these, the autologous and the designated or directed, need to have doctor's orders, and it's under the supervision of a physician for that patient. But the blood is safe. Most patients who receive transfusions, most of the blood being transfused is from blood donors who come in, our allogeneic units. And because they are volunteers and there's no monetary reimbursement, they have altruistic motives. They're doing it for good reasons. And we go through a very thorough screening process. And like I said, we go through all these questions. We ask a lot of high-risk questions, but those are important. And then the blood is all tested. And even if someone has been coming for 20 years, 5 or 6 times a year, and we do have donors who've been coming that regularly for that long, we go through all the same processes and all the same testing is done every time.
Again, so, very important because we want to keep our blood as safe as possible.
So the blood today on the shelf is safe for transfusion for anyone, and that's because of the extensive testing that is done and all the precautions that are taken even before collecting the blood.
Again, that questionnaire, which is constantly updated, also very important that the person answers the questions accurately.
Absolutely.
Since, again, that is a part of making sure that the blood that we do donate is safe.
Yes, yes, and that is the first step in the process, and it is critical that they are able to answer the questions honestly and truthfully and as accurately as possible. We right now are in the process of updating everything to address questions about the Zika virus. So, as things change in our world, we are updating those questions so that we can make sure that we have a safe blood supply.
A person who wants to donate blood, how frequently can they come?
For a whole blood donation, they can come every 8 weeks or 56 days. Up to 6 times in a calendar year. And most bodies are able to replenish the blood loss during that time frame. And when they come, even if they come every 8 weeks, we check their hemoglobin level every time, and that way we're able to make sure that they were able to replace that blood loss so that it's safe for them. And for platelet donations, they can, if they do a platelet and a plasma on an automated collection, and that is, we have a machine that we use, and they're able to be on that machine for this automated collection so we can get platelets and RBCs and plasma. And so if they do only platelets and plasma, they can come every 4 weeks. And sometimes if it's just a single platelet collection, they could even come back in 3 days because we're not taking the red cells. So, the automated collection is a great way to be able to donate. It takes a little more time. We ask the donor to allow 2 hours for that collection because start to finish, we still do all the questions and we do the physical exam, and then they're on the machine for maybe an hour, hour and a half at the most, and it allows us to get that platelet product. And there's no other way to get the platelet product. Okay, so if you want to.
You asked earlier in the show, Doctor, about how you can save 3 lives by giving 1 unit of blood. So the processing that takes place on a unit of blood after we donate that unit, the blood is taken to the laboratory and it is broken into its components, if you will. And in a typical unit of blood, we're able to make a plasma, a platelet, and the packed red cell. So that's where the slogan, if you will, save 3 lives, comes from. However, in 2016, it's preferred by most blood centers to be able to collect the majority of their products in an automated fashion for several reasons. Mostly because they can perform the same work using the same donor, optimize the staff, optimize the donor's time, and optimize the ability, the product availability in a very cost-effective and safe manner. Christia mentioned that we have collection devices in our 2 donor rooms. We even take them to blood drives with us so that if we want to collect platelets and plasma out on a blood drive, we have the ability to do that. Automated donation is safe. It does take a little longer, but one of the benefits is that you get to watch TV, you get to listen to your headphones. It's also a very, because it's a slower process, there's less of a chance that you would see any kind of donor reaction because of fluid loss. So it's a very gentle process. And so if you have good veins and a good body mass, we recommend that you consider donating in an automated way.
So it's probably a more technological way to do it?
Mm-hmm. Absolutely. And like Christia said, the benefit of being able to collect platelets by automation is unsurpassed. In the olden days, if you will, they would have to pool a very small amount of platelets from 6 to 8 donors together. And if you think about it very logically, 6 to 8 different people are just that. They're very different. So physiologically, they're very different. And you would be then introducing those differences to the very sick patient in the bed. An automated donation extracts the platelets from the body, gives back all of the other components to the donor, and you get a much purer, more concentrated, tolerable product, if you will, for that patient that's receiving products over and over and over again.
As I said, I remember as a medical student to platelet donations, it would take 6 to 10 people to get one of them, and it was even the ability to get 6 to 10 at each time.
Correct.
And the people who require that require lots and lots of that.
Cancer Institute of New Jersey, of course, our partner in healthcare at Robert Wood Johnson University Hospital, and Steeplechase, they use an inordinate amount of single donor platelets to help maintain a quality of life during the very rigorous treatment that patients that are fighting cancer go through on a daily basis. And I believe we transfused upwards of 12,000 single donor platelets just in New Brunswick alone last year to patients that are affiliated with CINJ.
The other thing, of course, we have to think about is that there are times during the year where people are away and the number of blood donations sort of drops.
Summertime, the holidays, You know, anytime during the year when people are not doing their routine schedules, that impacts our blood supply. So we are always looking, you know, for people to remember us and to not forget about the need for blood during the times when the routine is not the norm, during the holidays in the summer when people are on vacation. Or so yeah, we're always encouraging people. Just remember that, you know, healthcare continues and patients still have a need. We were talking about the platelets, and we really encourage people to consider donating platelets because the platelet product only has a 5-day shelf life on it, whereas red cells, packed red cells from a whole blood donation are good for 6 weeks. Okay, so that's one of the reasons we really encourage people to consider, you know, donating platelets, because we have to constantly renew those products and get more of them. It takes a little longer and it's a little harder to get that product, and it's only good for 5 days because it's stored at room temperature instead of in the refrigerator. But yeah, that again, to your question with the slow times during the year, we have our slow times just like any industry has its times when it's slow. So we encourage people to not forget about being a blood donor anytime.
Setting up blood donations at people's places of employment.
I'd like to really encourage the community that watches this TV show to get involved in blood donation by organizing a blood drive at your church, at your place of business, at your civic, through your civic organization. The process is simple. You pick up the phone, call Christia, call myself. We'll meet with you. We'll give you the marketing materials and the background knowledge that you need to run a successful blood drive. Particularly in the summer, when colleges and universities are not in session and high schools are closed, the need for blood really becomes very, very prevalent. In this particular part of the state, a lot of the citizens go to the Jersey Shore. During that time, we see a major drop in donations. So anything anybody can do to organize a blood drive would be a huge help to our patient population.
Things that would happen, they call you, you come out. What happens at the place of business? Is it a full day? Is it a half a day? How do you organize?
The most important thing to understand when you're going to organize a blood drive is the commitment prior to the blood drive. The amount of education and encouragement it may take to get people to sign up and pledge to be a blood donor that day. The day of the drive, we're normally on your site for 7 hours. The drive itself runs between 5 and 5.5 hours. Takes us about an hour to set up and an hour to break down. We can come as early in the morning as you like and stay into the evening as well. We start blood drives as early as 7 o'clock in the morning and run them till 8 or 9 o'clock at night. I'd also like to encourage people that have diverse backgrounds to get involved in blood donation. We just had a Tackle Sickle Cell event this past Saturday at Robert Wood Johnson and collected over 160 units of blood products from a very diverse population in support of our sickle cell program. Our pediatric sickle cell program. It was a great event, and we hope to do it again soon. But the blood drive itself, again, we do all of the work. Your job is to get the donors there. Once they're there, we put them through the process. We even feed them. So it's not it's not a financial burden on the company that decides to run a blood drive.
So again, the importance of the community helping to do this. This is all voluntary.
Right. And you know, probably everyone knows a family member or a friend or someone who's received a blood transfusion. So most of our blood donors, the ones who are faithful, have a personal connection to it. They've had an experience where someone they cared about needed blood. And even, I would like people to know that even if you've not had that experience yet, you probably will. At some point in your life, you will know someone who really needed a blood transfusion. And the only way that that blood is available for when they need it is through volunteer blood donors who come to our donor room or come to a blood drive. And blood has to constantly be replenished. So we depend on the community to support those. And all the blood collected at Robert Wood is for Robert Wood patients. It does not go outside to any other place. So it's all used in-house at Robert Wood.
And again, one of the few places that does do their own blood donations at Robert Wood Johnson. In-house, voluntary, and necessary.
Absolutely.
Absolutely.
And again, you talked about the fact that whole blood lasting 6 weeks, platelets lasting 5 days, the constant need to replenish it.
And it's always used. We very, very, very rarely have a product that does not get used before it expires. So the need for it is much greater than what our supply is.
Which is, again, important. The need is more important, is greater than the supply. The supply is very important, all done by donations, all done because we want to help each other. Because it's the only way to get blood, platelets, or any other products such as plasma.
Yeah,
That's correct.
And, you know, again, for the person who wants to donate blood, fluids, eating prior to it, giving the blood, consideration of doing a platelets also, using the automated system so that we can get the best donation possible. And also, if they're doing platelets, allows them to do it more frequently if necessary.
I would encourage anybody and everybody that if you have any questions, if you have any concerns, pick up the phone and talk to one of our medical staff. They will help you understand the process. They'll answer your questions. They'll let you know if you're eligible or not.
Thank you both for coming to the show.
Thank you.
This concludes today's episode of Robert Wood Johnson University's Health Talk. Please remember the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral number at 1-888-MD-RWJUH. For more information on Robert Wood Johnson University Hospital's blood center services or to schedule an appointment to give blood, please go to www.rwjuhdonorclub.org. That's www.robertwoodjohnsondonorclub.org. Thanks for watching.